Grace Sunday lost her third child last year at just 9 months old. She says she couldn't afford to pay $33 for further testing when her child fell ill and her local clinic was poorly equipped to help.
My child had a fever, and we rushed him to the health center in our neighborhood, but we were referred to another hospital. But we didn't have enough money to pay the bills, so we came back home and tried to treat him with local herbs while we looked for the money. But he died before we could do so.
Recent figures from the United Nations shows that globally, fewer than 5 million children died before age 5 for the first time ever. But Nigeria is among countries in Africa still struggling to tackle child mortality. The country is ranked as having the second highest maternal and child mortality rates globally, with the United Nations projecting that babies born in Nigeria, Somalia, and Chad are 80 times more likely to die before their 5th birthday compared to those in countries with lower child mortality rates like Singapore, Finland, and Japan. Analysts say a lack of access to quality and affordable healthcare is fueling Nigeria's child mortality rate.
What we have is about 57 deaths per 1,000 live births. In Nigeria, this is really a far cry from what is expected, because the standard that should, we expect, shouldn't be more than 25, deaths per 1,000 live births. Preponderance of the citizens of Nigeria are living below poverty line. They cannot afford healthcare. And the point is that most of these healthcare facilities are not adequately equipped. Most of these healthcare facilities lack the manpower to be able to provide the much needed, quality healthcare to the people.
Health experts say Nigeria needs to increase funding for the health sector as a first step in addressing this challenge.
Increase funding to the health sector to be able to provide for these levels of care, to be able to guarantee affordable and accessible health care for mothers during the antenatal period down to delivery and postnatal, which of course involves children, particularly children under the age of 5, because at that age, really, they are vulnerable.
In 2022, Nigeria signed a law that will see all citizens get health insurance coverage by 2030. The government has also promised to increase funding to the health sector from the national budget. And while these efforts will not bring back Grace Sunday's lost child, the hope is that it will help prevent other deaths of children under 5.